Commitment. For those working in the field of healthcare, it's an essential principle, one that not only impacts quality of care, but can make the difference between life and death. Within this commitment, nurses need to know what the professional boundaries are, what constitutes a conflict of interest, and how to work more collaboratively. With hospitals becoming more like marketplaces and ethical issues getting more complex every day, understanding and maintaining one's commitment can be a challenge.
They know they need to spend more time with the patient, they know they need to talk to them more, they know they need to provide support, moral support and emotional support to the patient, but the reality is the time for that is very limited.
Throughout the world, there are specific codes of ethics that function as reminders of a nurse's ethical duties. Common to all of these is an emphasis on the importance of commitment to the patients they serve. In the American Nurses Association, this is found in the second provision of the Code of Ethics, which will be the focus of this program. It states that the nurse's primary commitment is to the patient, whether an individual, family, group, or community. The primacy of the patient's interest is clearly emphasized here.
Well, I understand completely, Mrs. Perkins. You know what I'll do? I'll call Dr. Knowles and I'll ask him about changing the dosage on your medication to what you were taking at home and see if that helps.
I'd appreciate that. I know how busy you all are.
Oh, no worries. It's okay. That's what we're here for.
There's an inherent or potential vulnerability in individuals who need health care, and it's the nurse's responsibility to work for the patient's behalf as a moral agent and advocate. Advocacy refers to the formal or informal activities of a nurse that uphold the rights of the patient to receive safe care. Advocacy also means to empower the patient to act on his or her own behalf. This involves care that meets the unique and comprehensive needs of the individual and his or her family.
His wife has learned all the dressing procedures, but she works full-time. Is there anyone available to help during the day?
His sister has expressed willingness, and she's home during the day. If they're comfortable having her help out, perhaps that could be the solution. I'll see how they feel about that.
And recognizing the patient's place in the family and other networks. A good plan of care must reflect this uniqueness.
You have to individualize your care. You can't go in and treat every patient the same. You just can't, because not every person is the same.
Sometimes it's the patient's goals and the family goals may be in conflict. There again, we need to have some good, clear communication and get some clarity on primarily what the patient's goals might be.
In some critical care situations, a greater chance exists that patients and families may have limited or no decision-making capacity.
So we need to get Mr. Graves transferred to the floor in the next hour. I'll go make sure he understands that he's ready to leave the ICU and see how we can make this as easy as possible for him.
During this time, the nurse's responsibility is to work on the patient's behalf and serve diligently as a moral agent and advocate, providing safe passage through the healthcare continuum. But keeping the patient as the nurse's primary commitment when so many take part in the care can be a challenge.
It is rare for nurses not to talk to any of the physical therapy, occupational therapy, speech therapy physician in the course of a shift, in the course of a day. And these are just addressing patient needs.
Patient advocacy is accomplished through the interdependence of nurses in differing roles and working to make sure that all relevant parties are involved and have a voice in the decision-making. Naturally, some conflict is inevitable. When conflicts do arise, a nurse's commitment is again to act as an advocate for the patient.
Look, I think that we really need to take a longer look at Mr. Connor's lack of progress.
I think it's because he tells the doctor that he feels fine when he's still in a lot of pain. I talked to his doctor about it yesterday and he left without giving me any new orders.
Well, I'll give Dr. Soames a call again. I just don't want this man getting lost in the shuffle.
This means actively addressing issues and working towards solutions.
The registered nurse at the bedside is usually the first person who identifies an ethical dilemma, and really is the person in many cases who draws the parties together to have a discussion and facilitate a resolution.
There are various ways to address concerns of the patient, the family, or the team itself. These include discussions to update and reevaluate goals of care, interdisciplinary team meetings, ethics consultations, and mediation. The therapeutic relationship that exists between nurses and their patients requires that the needs of the patient in the interest of the nurses not be in conflict. Such conflicts are a serious violation of a nurse's commitment to patients and their families. Nurses have specialized knowledge and skills, as well as access to confidential information.
Yes, you can go ahead and send that information along about the patient. I'll give you the fax number that goes directly to medical records.
With this knowledge comes the responsibility to examine where a conflict of interest might arise between one's personal and professional values and the values and interests of others. These conflicts can arise from competing loyalties.
I really can't do that. It would be a conflict of interest for me to recommend my husband's company as his medical equipment supplier.
Nurses need to be vigilant in assessing for and identifying instances where conflict of interest might occur.
I can't do that.
This means avoiding situations that can give rise to actual or even perceived conflicts of interest. Some examples are actions that result in financial benefit to the nurse or personal loss to the patient, or the use of confidential information to exploit or coerce the patient.